Welcome to the Recruitment Hackers Podcast, a show about innovations, technology, and leaders in the recruitment industry. Brought to you by TalkPush, the leading recruitment automation platform.
Hello, everybody, and welcome back to the Recruitment Hackers Podcast with Max. And today I'm pleased to welcome on the show Blake Thiess from Prestige Care. Welcome to the show, Blake.
Yeah, hey, thanks for having me, Max. Really excited to be here and just chat with you about all things recruiting.
Absolutely. Great. Well, we're interested in finding out more about Prestige Care and in the midst of this 2020 pandemic. I imagine you've encountered some pretty unique operational challenges trying to bring in people to your facilities. Tell us a little bit about, as an introduction, who you are and what you do at Prestige Care, and then maybe a little bit about your company.
Yeah, no doubt, Max. Thanks. So I'm the Director of Talent Acquisition for Prestige Care, and we own and operate over 80 assisted living and skilled nursing care centers up and down the West Coast of the United States, mainly in Oregon and Washington, but our footprint does extend down into California, Arizona, Nevada. We have one up in Anchorage, Alaska, one in Kalispell, Montana. But really and truly, we're a Pacific Northwest company, family owned and operated since day one over 35 years ago. We employ about 5,000 people in that 8-state geographic footprint, and we serve about 5,000 residents. That's what we call them. They're not patients, they're residents. We live and work in their homes. In my role with Prestige Care, I oversee the entire talent acquisition function for a $500 million enterprise with over 80 locations. All areas of talent acquisition recruiting, whether it be, overseeing the ATS, the employment brand, any sort of TA or recruiting technology integration, anything involving talent acquisition recruiting, I oversee. I live and breathe this stuff. I love what I do. And most importantly, I love who I get to do it with. Outside of just the professional realm here at Prestige, I'm able to speak at a local and national level on all things recruiting and talent acquisition as well, which is something I really love to do. So yeah, that's a little bit about me and Prestige Care, really from the macro, Max.
Thank you.
Yeah.
Thank you. Great. And those 5,000 headcounts over the West Coast, could you give us a feel for, where the bulk of your hiring is? I imagine a lot of registered nurses.
Yeah, good assumption there, Max. Yeah, the vast majority of the folks that we employ are clinical in nature. So those certified nursing assistants, licensed practical nurses, registered nurses, that's on the skilled nursing vertical of our business. On the assisted living memory care side, we're kind of split right down the middle. Half of those 80 are skilled nursing facilities, and then the other half are assisted living memory cares. On the AL side, it's the lion's share of those that we employ are personal care attendants. Some outfits might call them caregivers, medication technicians, people who distribute medication. But we also employ a number of different operational type professionals that work in these locations. So you're talking facilities, we call them maintenance professionals, many culinary professionals, cooks, line cooks, dishwashers, chefs, people of that nature, really any type of professional to, oversee and help run a skilled nursing or assisted living community.
I'm actually paying a visit to a friend in a nursing home later today. And I don't know what the food is like at Prestige, but in my case, I'm always bringing him a little bit of food from the outside world.
Sure. Well, I've been able to visit. I've been here for over 5 years. A little over 2 of those years, I've been in my director of TA role, and I've been to probably half of them. And I'm not just saying this, our food is terrific. If you go to our Jobs at Prestige, LinkedIn, Facebook page, I actually like to post photos of the food that our chefs prepare. I'm telling you, it looks like it's straight off of Instagram, Max.
Oh, wow. Well, I could see why you're in recruitment because you're a strong salesman. But I reserve some, I'd like to believe it when I see it, or rather when I taste it. So before we jump into maybe this pandemic matter, the type of people that you hire, yeah, of course, when we think assisted care living, immediately we think doctors and nurses, but then there's all this other stuff that's around it where maybe they're a little bit less demanding on qualification, but just as demanding, if not more, on soft skills like empathy and the likes. How have you sort of structured and automated your pre-screening in order to find the right talents there, particularly for those folks who are interacting with the patients on a daily basis?
Yeah, good question. I wish I had some groundbreaking answer for you, Max, but ever since the pandemic hit in mid to latter March, it has been a challenge. I don't know how else to say that. I mean, here's a great example. So I sit on the client advisory board for our applicant tracking system, which is Healthcare Source. And so I've, access to all, data points and things of that nature. And I was sitting in a meeting last week before, and year over year for all of the Healthcare Source clients, they have seen a 40% decrease in overall applications for certified nursing assistants year over year. In the RN ranks, 25 to 30% decrease in overall applications. And so I wish I had a really great answer on how we've leveraged AI or tech to, understand somebody's empathy quotient, for instance, or something of that nature. But honestly, the volume of our applicants has just bottomed out. So, I hate saying this, but, if somebody pre-qualifies, if they're a CNA or if they have that RN license and they have any sort of relevant experience, we're going to talk with them. Yeah. That's just the reality of the market that we're in right now, especially the last 6, 7, 8 months.
Okay. Well, that does ring familiar. Yes. So sourcing is where the battle is, and
yes,
expanding the talent pool will make you do desperate things sometimes, go in places you wouldn't go. One area which has seen a lot of growth we've seen in 2020 is the rise of Facebook Jobs as a sourcing platform. Have you been able to get some of your healthcare? I mean, we don't have to spill the beans on your trade secrets, but it's just out of curiosity, is that an area where you're seeing a little bit of traffic?
Yeah, we were leveraging Facebook and Instagram to build our employment brand long before March 2020, pre-COVID, to build our brand, to get visibility out in the marketplace. So I wouldn't say that we've necessarily doubled or tripled down on our efforts there. I think there's opportunity there for us and, quite frankly, any organization. But I think what might be of value to those listening is, we actually piloted a new way in which we support our skilled nursing care centers out in the field. And so I developed this job title, what's called the Regional Talent Acquisition Partner. So basically, if you take, Max, an HR business partner role and you strip away everything else except the TA kind of recruiting function of that role, that's what I've developed. And so why that has been a big value add for our organization, it's a lot more high touch of our applicants. It's the Regional Talent Acquisition Partner does a lot of training and development of our on-site folks who are charged with doing the recruiting at our local level. And at the local level, they are not HR professionals, and they sure as heck aren't recruiters. So these Regional Talent Acquisition Partners are doing a phenomenal job of training and developing our local operators, number one, but number two, really driving the recruiting process forward. And that's really proven to be a game changer for us, because not only are they doing a lot of cold sourcing, to your point earlier, that's, the companies who are doing a lot of cold sourcing are really winning right now, but also it's providing more of a white glove service to our operators out in the field, which in turn, and to use business terminology, we haven't had to go into agency as much to staff these CNA, LPN, and RN roles. And as such, we're saving the company a lot of money through cost savings.
Yeah, great. The one part, I guess, that the hiring managers or operators will never really get good at is, they may get good at interviewing and all that, and even at increasing candidate referrals, which probably is an important factor in your world, because, medical professionals know other medical professionals, right?
Yeah.
But where they're not going to be so strong at perhaps is digital marketing and sourcing on digital platform. That would be the one piece that remains kind of centralized, I guess.
Yeah. In a perfect world, I could employ a full-time talent acquisition digital marketer. I really could. But in the absence of that, these regional talent acquisition partners are charged with building localized employment brand and employer value propositions at the local level. So that's really how, Max, that's really one of the ways in which our organization has I'm going to use the term responded to an unprecedented time. I've heard the term unprecedented so many stinking times over the last 7-8 months, but it's really true. I mean, that's how we have evolved and just kind of rolled with the punches and, really have done a phenomenal job kind of weathering this storm. I mean, there's a lot of opportunity, but I think we're on the right track.
Yeah, and the president gave a speech yesterday saying everybody should get over it and beat the thing, and so maybe that'll help your your candidate pipeline.
Who knows? Maybe.
And so I work with a number of people in the retail sector, and they have this structure where they have also a regional sort of TA lead that goes from store to store, and they do these sort of hiring events in a store or in a retail location, and they move, and every day is a different place, and they have a schedule for like where they're going to go see 10 or 15 stores in the course of a month. In your regional team, is that how it's set up, where you have different centers within their region, or it's one or two or more than that?
It just kind of depends on the area. I mean, I have one regional talent acquisition partner that supports our buildings here locally in the Portland, Oregon metro area. And then I have another regional talent acquisition partner who's based out in Yakima, Washington, so central and eastern Washington. So they're specifically geographically placed for a reason. Not only myself, but RTAPS also tried to leverage virtual career fairs, a vendor which didn't get that much of a response. I know that's a big push the last, 4, 5, 6 months, but, we didn't get a large turnout. I think, quite frankly, a big part of that was geographics. I mean, we ran a lot of these virtual career fairs in pretty remote markets where we have operations in. So that's a whole other topic, Max, trying to find people in remote geographic markets. It's supply and demand 101. And so that's a business problem I try and solve literally every day.
Okay. And for that sort of localized sourcing and the edges of the map,
yes.
What what's your toolkit on the sourcing side? Is it, you still go to like local job boards, and it's kind of like, I'm even afraid to say it, but like print?
Yeah, really. It's really interesting you bring that up, Max. In some markets, print still wins,
Wow.
Especially the small, remote, local markets. I mean, there's really one way in which people find news or, stuff like that, and that is the local newspaper. And so print is not dead, ironically enough, in some of our markets. But to really, address your question, it's tough. I mean, I don't have a silver bullet. One thing that we coach and teach at scale at our company is treat especially Max in these remote locations, treat every applicant like a 10-carat diamond. You have to roll out the red carpet for these folks, but also we teach the art of pursuing them. You just can't reach out and leave a voicemail once and just give up. You have to reach out via voicemail, you have to email, you have to text, do whatever it takes to get in front of them. So it's constantly pursuing folks, leveraging technology. I mean, some kind of basic technology. This may not be revolutionary for many of the folks that, listen to your podcast here.
You said you were working with an ATS, which is industry specific. I had never heard of it. Healthcare something, right?
Yeah, Healthcare Source is the name of it. Yeah, it's primarily focused in the post-acute space.
So I guess, the name tells it all, right? They're going to help you source for healthcare.
Yeah, well, I mean, yes, they post our jobs to various job boards, but yes, they do help source.
Okay, great. Cool. And well, to get back to the pandemic stuff, the volumes of candidates have dropped. Has other metrics like, show rates and sort of candidate dropouts, has this been affected, where somebody wants the job and then they get scared and decide, no, I'm going to stay at home. I don't want to be exposed to an environment where there's a lot of elderly citizens?
Yeah, we don't track those type of data points, Max. That is something that we're aware of and we've run into. I can't really lean back on data to say, oh, well, we've, seen a 20% decrease. But, one thing we teach, ever since this whole mess started, was you need to be as transparent as possible with people. That way they know what they're getting into if they do choose to go down this path. Now, a big a huge issue in latter March, early April was this concern of, oh, well, these places are going to run out of PPE and it's going to be this huge thing. Honestly, I was in our office actually just yesterday, and I've been going in periodically over the last few months. Our office actually has never closed, which is pretty funny. But we have this huge, we call it the education room, and it is stocked full, Max, floor to ceiling of PPE. I'm not concerned that we're going to run out of PPE, and I've never been concerned. And so it's honestly, it's a very, you might think it's not a safe environment, but honestly, all of our folks are tested almost on the daily, I believe. I mean, we adhere to all state regulation, and the lion's share of our buildings are in states that they have really gone all in on safety. And so you could make the argument that these places are, quite frankly, safer than going to the grocery store, for instance.
Yeah, I guess there's still plenty of people who are looking at this rationally, or try to, but I don't know. You did say volume drops. You think volume drops which is surprising at a time when you have 30% unemployment. Yeah. I was wondering whether you see some sectors of healthcare more affected than others in terms of candidate activity.
Yeah, I don't know. I can't really comment on what my colleagues in the acute setting are seeing. I know in sitting on that client advisory board, they did share some hospital stats, which really mirror what we see in the skilled nursing and assisted living space. But, there's a lot of schools of thought as to why there's been such a drop in overall applicants. I mean, here in the States for, many months, I mean, there was a $600 a week kicker for unemployment on top of the unemployment number. So people were making a boatload of money not working, and more than likely making a lot more money than being a certified nursing assistant at a skilled nursing facility or a caregiver. So, we ran into that quite a bit. I think that's one of the major reasons why you've seen a sharp decrease. I think a lot of people are scared as well to work in some of these locations. So trying to combat that false narrative has been challenging as well.
Yeah, I bet. Well, this is going to be a bad expression, kill you makes you stronger. And I mean that applied to talent acquisition, which, you have new stressors now in our organization, and we have to find, new solutions. You come out of this crisis, candidates volume go back up, but your sourcing engine will never be exactly the same. They will be optimized in ways that you didn't know you could.
Absolutely. I mean, there's opportunity in chaos. I truly believe that. And I think it's the people that can evolve and level up. I always kind of joke, Max, if you can see massive success in cold sourcing and recruiting and skilled nursing or assisted living, you can really see success anywhere. It's a challenging environment, but when we're pushed beyond our limits, that's where the growth is. That's where we evolve as humans and as professionals. And I can only speak to my own practice and the practice of my colleagues, and we've had to do different things at scale. And, I'm confident that we're riding this wave and becoming better for it.
And so we don't sound like technology evangelists who have had too much of the tech Kool-Aid and kind of like balance it out with maybe some areas where technology has fallen a little bit short of its promise. Do you have some examples in mind? It doesn't have to be recent. It can be from previous years where, you tried something out, you wanted to automate it, and then you had to step back and put the human back in the loop.
Yeah, good question. I can't really think of anything specific.
We had a lot of customers, for example, when they heard that we do conversational AI chatbots and applied to sourcing, wanted to completely remove all of their phone recruitment team and say, okay, great, we'll let the bots do it. And instead of reducing it, like completely removing it. And that had very adverse results. We found that a hybrid system was optimal.
Yeah. I think, Max, I'm going to maybe get on my soapbox a little bit. There's so many great, tech pieces out there that can really help people. But at the end of the day, recruiting is a person talking, engaging, and hiring another person. It's human to human interaction. And we need to use tech as a tool in our tool belt, but it cannot be the golden gun, as it were, right? It can't be the end all be all. You need to leverage technology and use it in your recruiting tool belt. I know for us here at Prestige, we've been able to integrate two pretty nice tech pieces into our practice. One is texting out of our applicant tracking system, which has really helped us, especially during COVID times. But secondly, interview self-scheduling. So, being able, our operators on the back end, being able to click a couple buttons, send out a message to a candidate saying, hey, select a date and time, and then line up that interview. That has saved us so much time. And so I think those are two really good examples of not just fully relying on tech, but utilizing tech as just one of the tools in your TA tool belt.
Yeah, for sure. Those will move the needle. And it's interesting you said text, especially now. I think that especially now makes sense in the sense of any edge you can get, you shall take.
Yep.
But text would, I don't know, we kind of imagine the candidates stuck at home in front of their computer, more available on email than ever. But maybe they're out hiking, maybe they're out enjoying nature. So you gotta go get them.
Yeah,
and text can do that for you.
Yeah, that's right. I mean, like I said, it's not a revolutionary piece of technology, but I would say, at least in the skilled nursing and assisted living space, there's not a lot of companies that are leveraging some of these pieces that we've been able to integrate here at Prestige Care.
And just a couple of years ago, by the way, most of the ATSs did not have text and interview scheduling and synchronizing with Outlook and Gmail. They've added it. There's also those point solutions that people can use. So people can usually get it from their ATS. If not, they can plug in something quite easily. So yeah, plenty of options there. Well, Blake, thank you very much for sharing your story. And I'm sure some of the listeners will want to reach out to you. What's the best way to get a hold of you?
Yeah, great question, Max. So anybody can follow me on Instagram or Twitter. My handle is Blake in the PNW. So Blake in the Pacific Northwest. You can find me on the LinkedIn machine, Blake Thiess. Outside of that, Prestige Care, you can check us out on YouTube, Instagram, Facebook, LinkedIn. I actually run all of our social media channels here at Prestige relative to TA and recruiting. It's a lot of fun being able to share employee stories and things like that. So, definitely follow me on those platforms. I try and pump out as much content as I can. Time is limited these days, I'll say that. But yeah, thanks so much for the opportunity, Max. Really enjoyed our conversation today.
Great, Blake. I'll go check out your social media feed, and thanks for joining us and telling us just the story of Prestige in these, unprecedented.
Thanks, Max.
I looked it up, actually. There's that Google Ngram where you can measure, how often the words are being used, and this one's having a great year.
Yeah. Thanks again.
All right. Cheers.
That was Blake Thiess from Prestige Care. And what a bizarre world we live in, where in spite of 30% unemployment, we're seeing a 40% drop in candidate volumes. Blake's made the most of it with the use of a localized HR or TA business partner, as he calls them, and text recruiting, as well as self-scheduling of interviews. All good tips from Blake. Hope you enjoyed it, and if you'd like to hear more, please subscribe and share with friends. Bye-bye.